A concept related to neurologic system is intracranial regulation. This concept represents mechanisms that facilitate or impair neurologic function. Strong bidirectional interrelationships exist among different concepts. As brain function requires perfusion of oxygenated blood, and respiratory and cardiovascular systems are impacted by neurologic control. This model that you're seeing on the screen shows the interrelationships of concepts associated with intracranial regulation. As you're going over general health history and problem-based history questions from your textbook, as you have been doing with previous chapters, pay attention to different terms like dysphagia, dysphasia, aphasia. Routine technique for this examination will include assessing mental status and level of consciousness, evaluating speech, noticing cranial nerve functions, observing gait, and evaluating extremities for muscle strength and tone. Introducing yourself, greeting the patient, and noting their response would be a good start for assessing mental status. The patient is expected to turn towards you and respond appropriately. Ask the patient his or her name, where he or she is, and the date to assess knowledge of person, place, and time. For elderly patients, a general idea of the month or season along with year can be acceptable. The patient should be alert and oriented to person, place, and time. This will be documented as alert oriented ×3. Sometimes we go further to ask about why they're there in that clinical setting. Then it will be documented as alert oriented ×4 if they respond to it appropriately, since patient is also oriented to their situation. A change in level of consciousness is the first sign of impaired cerebral function. Glasgow Coma Scale is a 15-point numeric scale to assess consciousness. This scale is useful to assess patients with altered consciousness. But you will need to have your baseline when you start your shift, so you can note any change if it happens during your shift and compare it to that baseline. So in Glasgow Coma Scale or GCS, patient is assessed for the best response to eye-opening response, motor response, and verbal response. For example, when assessing the patient who has altered consciousness and is paralyzed on one side, you will use patient's unaffected side for best motor response. A number per the scale will be assigned to describe the motor response. The response observed from the patient may be a localization of pain, that will be score of 5, when he or she moves as if trying to remove the stimulus. An attempt to withdraw from the stimulus will be score of 4. Abnormal flexion would be score of 3. Abnormal extension will be score of 2. Or no response at all to any painful stimuli will earn them score of 1. There are different adjectives used to describe consciousness in decreasing order of consciousness, which are lethargy, obtunded, stuporous, semi-comatose, and comatose. If patients are lethargic, they can be aroused by saying their name and touching them. When aroused, they respond appropriately but return to sleep as soon as the stimuli ceases. Those who are obtunded require louder verbal stimuli and vigorous shaking to prompt a response. They carry out requests while awake but return to sleep when stimuli stops. Patients who are stuporous require painful stimuli to respond, and the response usually is a withdrawal from the source of pain. Semi-comatose patients require painful stimuli and respond with abnormal flexion or extension. Comatose patients do not respond to any stimuli, even central pain. When the patient is unable to speak because of an endotracheal or tracheostomy tube placement, the best verbal response of the GCS cannot be assessed. Each institution has its specific way of documenting this. For example, if the patient is comatose, the score may be recorded as numeric 2 and capitalized T, 2T, meaning 1 for best eye response, 1 for best motor response, and T for tube, indicating that verbal response cannot be assessed. A score from 14 to 3 is considered abnormal. The lower the score, the deeper is the coma. Evaluate patient's speech. It should be clear and coherent, and his or her responses indicate an understanding of what is said. Collect data about expected cranial nerve functions during the interview. Also notice any numbness or tingling in any part of the body. Observe patient's gait for balance and symmetry when they walk. When evaluating extremities for muscle strength and tone, ask the patients to flex the muscles being evaluated, and then resist those muscles when you apply opposing force against the muscles. Muscle strength should be bilaterally symmetric with full resistance to opposition. Can you think of a few reasons for any abnormal findings? When checking patient's hand grasp, expect it to be equal and firm, and notice presence of any deviations from the norm. And remember pupil check technique from Module 3, Chapter 10? Keep in mind to do pupil check by bringing light in from periphery in darkened room. Always go over common problems and conditions, and also the documentation of expected findings in each chapter.